As part of our first aid series for parents, today we'll be talking about falls. Now we see majority of the time parents worrying, especially when the child falls off the cot during the sleep, and we are not quite sure when it is serious and what should we be looking out for. So if you do identify your child has fallen off the cot, it's important to identify what is the height of fall. So normally we say roughly about 2 or 2.5 times the child's height. Anything above that is a serious fall. So if it is something less than that, majority of the times we could get away without serious injuries. However, it also depends on various other factors. What is the landing surface like and what is the impact? How did the child fall? So if you do identify your child has fallen, make sure that you strip the child and assess. So find out. I would start or recommend a head to toe feel of the child. So start off with the head, make sure that you identify if there are any cuts, wounds, bumps, and then feel for different parts of the body to see whether the child is able to move their limbs and whether there's any pain points. If you do identify that, you can give a painkiller to the child and assess whether your child is alert, active, is responding to you and is moving all 4 limbs. If you find that your child is not responding or is responding only to voice, if the child has something like fits, if the child is having injuries where they are not moving part of their body, it's important to come and visit the doctor immediately. If your child is not having any vomiting, if your child is active, back to their normal self and their regular activities, you can manage at home, you can apply some ice wherever you find a small bump. However, if you find these red flag signs, you must make sure that you visit the emergency department. Here at Aster RV Hospital, children's emergency services are open 24/7 and trained pediatricians are available round the clock. I am Dr. Sujatha Thyagarajan. I am a pediatrician and a pediatric intensivist based at Aster RV Hospital.